Welcome back, guys. I actually have a pretty cool treat for you if you have been listening in since day one. We have Dr. Shannon Sauer-Zavala on, and if you that name sounds familiar, she was on season 3 talking about her clinical trials with borderline personality disorder and how to better treat it. Those trials are done. We now have the full workbook that she had been chatting about. It is called BPD Compass. It is currently out for pre-order now and will be available August 1st. I am so excited to talk about what she's been up to the last 2 years. Hi, Shannon.
Thank you so much for having me. I am really excited to be here too.
I'm so stoked. So fill me in on what the last 2 years has looked like. You finished the clinical trial. What's been going on from there?
Yeah, so we finished the clinical trial and like any research or data nerd that I am, I have been poring over the data and have been writing up the results like you do in in academia, to disseminate to other researchers, right? And part of the reason I'm so glad that you're having me back is because I don't want the impact of a treatment that we now know works really well to sort of stay inside academic journals, amongst people that already know this stuff. I developed a treatment to make treatment for borderline personality disorder more accessible, more efficient. And so I want people to know about it. And so, over the past 2 years, I've been working on sort of this like science communication side hustle. I've been talking about personality change and treatment for borderline personality disorder on my Instagram and my LinkedIn, which is very weird. None of my colleagues really do that. But, for me, I really wanted to communicate real evidence-based information to the people that actually need it. So that's what I've been largely up to over the past 2 years.
Yeah. So what made you guys decide, okay, trial's done. We can definitely move this into publish the workbook?
Yeah, absolutely. So the results. So we set out to create to fill gaps in the treatment landscape for borderline personality disorder. So existing treatments for BPD were developed to be long-term and intensive from the start, right? So at
Sure
least a
are.
year and often twice weekly.
Yep.
Uh, and that just really is not going to work for a lot of people. And because borderline personality disorder is so variable from person to person, twice weekly, year-long treatment is overkill for a lot of people. You could see relief a lot faster, or at least that's what we thought. We do head-to-head comparisons of like gold standard treatments, like an emotion regulation treatment like DBT, or a more relational treatment like mentalization-based therapy or transference-focused psychotherapy, they're equivalent. So both of these treatments get the job done for about 50% of the people who get them. And 50-50 odds is not great. So we have to do better. And when you ask people in qualitative studies, what did you think of your treatment? They say, well, it addressed some of my issues, but not all of them. Mm-hmm. And so for us, like if we were going to develop a treatment, we wanted it to be short term. So BPD Compass is 18 sessions long, takes about 5 to 6 months. And it is comprehensive. So it addresses both the emotional dysregulation that gets like top billing in DBT, and some of the relational trust attachment stuff that we see get addressed really well in these relational treatments. So short-term and comprehensive. And what we found was that, across 18 sessions, we see significant decreases in BPD symptoms. That's clinically significant. So these are large effect sizes, comparable to about a year of DBT in 18 sessions. So we're pretty thrilled about that.
Yeah, that is absolutely incredible. Now, just to refresh for people that are new listeners and whatnot, why study borderline for you?
Yeah, so when I graduated from college and I took a gap year before I went to grad school, and I worked in a residential treatment hospital. It was private. And, there I was with my bachelor's degree leading these like supportive therapy groups for mostly young adults. So people kind of in my same life area. And like I had no business leading these groups. I had no training aside from like a psychology major. And it really struck me like this doesn't feel right. That these people are really suffering, and like their care is entrusted in part to me with no training. And so when I went to graduate school, I wanted, number one, to learn evidence-based treatments for borderline personality disorder. My first and like clinical experience was as a DBT skills group leader. So that was like definitely, I was definitely committed as a first year graduate student being like, okay, I'm ready to lead skills group. And then, and then I also think too, BPD is so deeply misunderstood. When I work with patients with borderline personality disorder, I think you'd be hard pressed to find a harder working group of people. It's like you have to work so hard just to like hold it together. You're trying so hard.
Sure
and
do.
I see that, right? And I'm just like, let's redirect that trying to like to skills that'll actually help you. But I mean, I love the effort, I just find it so rewarding to work with people that are really just doing their best.
Right. So what have you seen as a whole in borderline treatment from back when you were doing the residential stuff to now? Because I feel like treatment has come a very long way, even in the like 8 or 9 years that I've been either in treatment or yapping about this.
Yeah, for sure. So, you don't really have to go back that far to encounter the belief, not just from, commenters on Reddit. I don't know if Reddit was around then, but you don't have to go
It's
back
been around
that
for
far.
a hot minute.
Yeah, like not even, randos on the internet, but like mental health providers who believe that borderline personality disorder was not treatable. And so, really, you don't have to go back that far. And so DBT, I think, was originally published in 1990. So, that's like a long while ago. And it's only just grown in popularity. And, I think DBT can really be credited with changing the narrative. Like,
Yes.
wow, this is a condition that responds to treatment. And then we also have, this is not like treatment research, but like we have really good longitudinal data following people for now, I think almost 30 years. And what you find is that most people with BPD get better over time without treatment.
Yes.
You just get better a lot faster if you have treatment, like good treatment, the right treatment. And so I think, fast forward to now, I think DBT changed the landscape to like BPD is treatable, but you need to have a highly skilled therapist trained, in a very complex protocol, and it's going to take at least a year. Now we know that, BPD treatment can be short term. There's all these studies looking at, 6 months of DBT seems to be equivalent to 12 months of DBT, like on average, right? There's always going to be people that need more. There might be people that need fewer. But on average, we're seeing people get better a lot faster. And that's, I think, what BPD Compass adds to the conversation.
Yeah. So can we kind of dive into what your trials kind of showed over time?
Yeah. So BPD Compass was designed with borderline personality disorder in mind, but instead of targeting the symptoms per se, we target the kind of underlying personality factors that put somebody at risk for BPD. And so that's tendency to experience negative emotions strongly and frequently. It's tendency to engage in protective behaviors or have difficulty trusting other people, often because your experiences in the past have shown you that, what you can expect from other people. And this could be, as serious as something like childhood sexual abuse. It also could be like having a partner in a formative, your first love cheat on you, right?
Mm-hmm.
It runs the gamut, and
Right.
so, I mean, that's another BPD myth that, all people with BPD have grown up in a toxic situation
Mm-hmm.
or, have suffered abuse. That's it's not uncommon, but it's also not everybody. So, okay,
Mm-hmm.
so relational stuff. And then the third piece that BPD Compass adds that really is not, I think, on the scene in existing BPD treatments is how to address just trait impulsiveness. So, DBT addresses impulsivity when it occurs when a person is experiencing a strong emotion, like, oh, I'm so upset. I'm going to, house this bottle of wine, right? And then I'm going to feel
Right.
nothing. But some people use substances or drive fast or, skip out on work because it feels good and it's fun. And that's, I think, not really addressed in some of the other BPD treatments. And all of this preamble to what we found is that these risk factors are not just for BPD.
Mm-hmm.
So the tendency to experience negative emotions is really important for anxiety disorders and depression and eating disorders. Relational difficulties really important for PTSD and other personality disorders. And impulsivity is really important for substance use disorders. And like, these are the disorders that commonly co-occur with
Yep.
BPD. Most people, like in our clinical trial, folks had on average 3 diagnoses. And so all of this is to say that not only do we see these really great improvements in BPD symptoms, but we see improvements in social anxiety, in generalized anxiety, in panic disorder, in eating disorders, in depression, and in substance use disorder. Again, in 18 weeks. And I think, this is what happens when you target, you go for the root of the problem instead of trying to like cut off the heads of the symptoms.
Yeah. I want to kind of circle back to something really interesting that you had said in when you were just talking, um, that there is that myth that in order to have borderline, you have to have like severe long-term childhood trauma. And as somebody who I didn't grow up in like a crazy like abusive household, but there were elements of abuse. Like, can we dive into that a little bit more on how it's more trait related and whatnot than it's kind of built like from that severe trauma?
Yeah. So, well, the first thing I'll say is that there are different routes to Rome. So, in
Yes,
the same way,
1000%.
yeah, right. So, in the same way that, no two people like have exactly the same constellation of
Yep.
symptoms, you can get to borderline personality disorder via different personality vulnerabilities, right? So
Yes.
on our trial, we have people that just have elevations in that negative affectivity, that emotion piece.
Mhm.
Then we have people that have elevations just in that like trust relational piece. And then we have people that just have elevations in the impulsivity piece. And then we have all different combinations of those. And so when we think about, a route to BPD that like is not necessarily like abuse related, you can imagine somebody that experiences their emotions really
Yes.
strongly. And the environment is not necessarily abusive, but it doesn't necessarily know like what to do with that, right?
Right.
And so well-meaning parents are like, it'll be okay, it's not a big deal. Right? And
Yeah.
like, you learn through those communications that, oh gosh, like I should be able to turn this off. I shouldn't be feeling this way. It's going to be fine. Like, why am I overreacting like this? No one else seems to be overreacting like this. It must be me. I should try to control it. And it's like those beliefs, right, that lead people down a path of like, um, let me engage in some of these behaviors that work like a charm to regulate my emotions. So I can just cut them off, but maybe are
Exactly.
not consistent with my long-term goals.
Yeah.
So that's one pathway.
Yeah. No, I think it's really interesting that you mentioned any of that because I think I'm coming across more and more people with borderline that are like second guessing their diagnosis because they're like, from what I've seen on Google, it's supposed to be this, this, and this. And it's like, no, sometimes it is the genetics of the predisposition that you just have a lot of emotions. And if there wasn't that emotional safety, or if you felt that there wasn't, you're like, your brain couldn't track that emotional safety, then you wind up with the substance abuse disorders and things like that because you do. I mean, I know I drank to shut the feelings off because I knew I was feeling too many of them.
Yeah.
And, it just the ball keeps rolling in a not great direction.
Yeah, right, because it works, and
Yeah.
that's like, it's reinforcing, and so we wanna do things just, I mean, I hate to liken us to rats pushing a lever, but, like, in a lot of ways we are because we're built to maximize pleasure and
Yep.
to minimize pain, and so if we find something that works to minimize pain, we're gonna keep doing it. And I think, like, it's worth, like, mentioning too, like, emotion regulation skills are skills. Like, you're not when you're a baby, you're not born knowing how to regulate your emotions. And so
Exactly.
if you're in a household or in a school system, right, where you're not being actively taught, like if you're just being told like, "Oh, it's going to be fine, don't
Right.
worry about it." You're not getting, like, that's well-meaning, but you're not getting the tools that you need.
Hmm.
Um to like your own kind of like owner's manual for how to deal with yourself, right? And so the emotions themselves aren't bad. It's just you need to work harder to, than somebody who doesn't experience them as hard, like as strong, to regulate them. And somebody has to show you how to do that.
Yeah. So what are you seeing with obviously your trials are completed, the workbook's about to come out. What are you tracking your trial participants still to see how they're doing even like 2 years later and how they're doing with their emotional regulation and treatment as a whole?
So unfortunately, we are not. We do have 6 month follow up data that
Yeah.
I was thinking about the other day and was like, why haven't I looked at that? So I think it's because I have to clean the data, and that's like an arduous task. So that's next on my radar. That'll be the next paper that I write. But we do have funding from the National Institute of Mental Health. So they see the promise in this
Mhm.
approach, and so we've got, I think it's like $6 or $7 million to do a personalized treatment where the modules in BPD Compass, the emotion one, the relational one, and the impulsivity one, you only get the ones that are relevant for your symptoms, right? So a
Mhm.
personalized delivery. So that's the next piece, and we're planning to follow people for 5 years after that, to really see the impact. Because I recognize the error of my ways, not thinking, oh, I'm going to want long term data on this.
Well, I mean,
Um,
the clinical trial is a clinical trial. Like this whole thing is a giant clinical trial of, trial and error for you as well.
yeah. Absolutely, right? You learn as you do, as you go through this process. I will say that, like, I've kind of switched hats a little bit. I mean, I
Mhm.
have learned a lot more about book marketing that anyone would ever want to know. I
Yeah.
should say, like, I mean, as in, like, disclaimer, if people buy the book, I get royalties, but it's like a tiny percentage. And so
Right.
mostly the book marketing for me on like a self-help or a treatment book is because I know that it works and I really want people to get their hands on it. So one of the things I was doing was going back through the feedback that clients
Mhm.
gave us when they finished the treatment. And I made little Instagram posts of them, and I just was like crying happy tears. I mean, people were so kind and so enthusiastic about the treatment. Like stuff like, this treatment changed my life. I'm
Oh.
so grateful for the opportunity. This treatment showed me that I can shape the person I'm becoming
Mhm.
through the choices I make. This treatment made BPD a lot less scary for me. Like, these are, I mean, oh my gosh, just like music to the ears of somebody that like got into this profession to help people.
No, 1,000, especially it made it less scary because honestly, living with it is terrifying. You are scared of your own brain.
Yeah. Yeah. Well, I feel like if you just like get on the internet, you're like immediately being gaslit just by
Oh my
like
god. Oh my god.
Google.
Yeah. Yeah. So let's dive into the workbook because
Yeah.
that's why we're here. How is it structured? Obviously, you may or may not want to give too much away on how you do the treatment, but let's dive into what sets this apart besides the 18 weeks, but what in that workbook makes it capable to be treatable in 18 weeks versus that year or more?
Yeah. Yeah. So we think that it's more potent because it really is going past surface level symptoms and giving you like when you want to drink, do this. And
Ooh.
like really going to the heart of like, you tend to feel reward when you do impulsive things, maybe more than the average person. What can we do about that? So it
Mhm.
really is about shifting those personality traits. And we actually see, I didn't mention this before, but like we see changes in negative affectivity, in attachment, and in like self-efficacy to follow through with a goal also. So that's all really exciting. The treatment starts with really just kind of explaining, yes, you have a BPD diagnosis, or maybe you are curious that you do if you're picking up this book, and like kind of forget what you've heard because like everyone's symptoms are going to be unique, right? And so these are the symptoms you could have, and these are the risk factors that could go into it.
Mhm.
And we have some case studies so people can kind of see what that might look like and kind of recognize themselves. And then there's this whole section on how to personalize this treatment for you. So it's a little bit more of a choose your own adventure.
Yeah.
And that's where we
Ooh.
get the efficiency, right? When you
Mhm.
think about a treatment like DBT, which works super well, it's got, I don't know, 100 different skills. And like some of
Yeah.
that, it's more of like a throw spaghetti at the wall and see which one works for you kind of thing.
Yeah.
For us, we want to use data to get precise on what will work for you because our studies told us that it would. Um, so we do a couple things to personalize treatment or to come up with a personalized treatment plan. The first thing is that people take an assessment. It's called the 5-factor borderline inventory, and it basically is looking at those underlying traits and kind of showing where those elevations are. So you get to see, like, am I more of a negative affect, strong emotion person? Am I more of a trust attachment person? Am I a combination? And so that's going to be tied directly to particular chapters or skills later on in the book. And then we also have, and this is really one of my favorite parts about the treatment, even before we do that assessment, we do values identification. So we go through different areas of your life and we say, in an ideal world, your aspirational self, how would you show up in romantic relationships? How would you show up as a parent, as a friend? How would you show up in your career? And like, this isn't goals like have a kid or get this promotion. It's like, I want to be reliable. I want to be this. I want to be that. And we use that as sort of a guide for selecting additional skills that you might want to learn, and also as motivation to practice, because when you see in black and white, like, this thing is making me feel better right now, but it's actually taking me farther from the life that I want to live, like that's kind of the
Mhm.
the like focal point of the treatment. We see people get really motivated, and I don't know that I was expecting the values piece to be as moving for patients as it was,
Yeah.
but I mean, probably all the patients that I worked personally with during the trial, we're coming up on like session 16, so far away from the value stuff, and they're like, yeah, and it wasn't in line with my values, so I took a step back and did something different,
I love that.
but they're bringing it up spontaneously. So
Yeah.
that's kind of the beginning. So I can stop there and see if you have any questions about
Yeah, no, I mean, we can dive in as much as you want because I am just absolutely fascinated with, especially with how much different this feels from traditional therapies. I went through the old school way of DBT, group therapy every week, individual therapy also every week, and it was draining. So hearing this is just like so refreshing, and hearing um kind of how it's all working is just, you know, and to kind of side note a little, I am sure you're so sick of hearing about this, but a big quote unquote comorbidity of BPD is ADHD. Were you finding that a lot in your trials as well?
Yeah. So this is like another regret is that we didn't assess for ADHD. It wasn't on our like structured interview. And I'm like, damn it, why? Why didn't I assess for that? So that's something that we will, that in our big clinical trial that's going to start, our personalization trial, we will assess for.
Yeah.
But, I've been learning a lot about this personally because there's a lot of research on like seeing ADHD and like the emotion dysregulation that comes from ADHD in like tween and teen girls. And I have a fifth grader going into sixth grade, and she's a big feeler and she has ADHD. And, I see these, as a parent, it's really interesting being on the other side, because as a parent, in my mind, I'm like, that is not a big deal. Like, why are you freaking out about this? And then I'm like, okay, it seems like you're having a really hard time. Let's take some deep breaths together and talk through how we can problem solve it. But I'm like white knuckling it the whole time because she's screaming at me. So that's been like of just particular interest to me personally on how like I can see in some of her behavior the through line, and how so another thing I think that happens a lot is that girls are diagnosed with ADHD a lot less frequently than boys.
Yes.
And, and women are diagnosed with BPD a lot more frequently than men. And I just wonder, like, if girls got effective treatment for their ADHD early on, that it could reduce like the eventual path towards BPD.
Yeah. No, I both girly over here. So I also wonder that a lot. I'm like, because nobody knew what ADHD looked like in girls. We sat still, we read a lot, a lot of the symptoms of ADHD are actually praised in girls. And that's like a hill I will always die on. Like, you're so organized, you're effective. It's like, and I am screaming internally the entire time.
Just holding it together to make it look like, and I know that my daughter is doing that too, because home is her safe space. So she like just unravels at home. But you go to school and the teacher, oh, I wish I had 19 Fionas in my class. She's such a good listener. My kid. So I know she's like white knuckling it the whole time to make that work.
Yeah. So, but boys are expected to be more off the wall. So it gets more easily diagnosed versus women feel more. Men are not, still in 2026, not allowed to really like outwardly feel anything. So it makes total sense why the data is the way it is. But I'm also wondering, like, hopefully in 30 years, we start evaluating girls with ADHD, and maybe it's not a direct pipeline to BPD. I will say that 1000%. I know so many people with ADHD that couldn't qualify for borderline if you paid them. But, it's more likely, what's the word I'm looking for? It's not you're more likely. It's just like a higher chance or higher probability that it could lead that way.
Yeah, because I think like not all people with ADHD have BPD, and not all people with BPD have ADHD, but a bigger proportion do.
That Venn diagram's looking a little close together.
Yeah.
So let's just say, because we've talked about how you would do it going forward, but looking back on this clinical trial, what are like your top 3 things that you definitely want to do for the next trial that you wish you would have done with this one to just tweak it a little bit?
Yeah. Well, so I can talk. I mean, obviously, like you have asked me about long-term outcomes and like different things that I haven't assessed for. And so yeah, those things so you hit the nail on the head, and those things are already on our radar to like include in the next study. But I will say that like with the published version of the workbook that's coming out, we've actually made some changes from the first clinical trial based on feedback that we got. And also like as we have sort of a like a mini trial that we just finished that was like testing the improved modules for negative affect, attachment, and impulsivity. So I can tell you about one of those changes that's kind of coming to mind for me. One of the things we noticed was that people that were higher in impulsivity were more likely to drop out, which is like, okay, yep, that makes sense. That checks out for me. And so we tried to figure out, we actually have a consultant on our new grant that is sort of specializes in conscientiousness, in like making people more, more likely to follow through, like that kind of stuff. And so, one of the things that he said, which is like makes perfect sense when you hear it, is that it's a lot easier for people to bring like good behavior online than it is to inhibit like bad behavior or bad habits. And so, when we talk about behavior change, well, in the original like study, everybody got all the skills and everybody started with cognitive skills. So thinking, changing your perspective. And that's like a slow burn. That's not active enough for people that need a reward. They need a win right now. So we shifted the behavior change skills earlier for people with more of like relational difficulties in the picture and for impulsivity. And we added, before we even get into the behaviors that are like not working in the long term, we have this calendar where they do the values, and then we're like, okay, we need 10-minute tasks that you'll do, 3 times a week that are in line with your values. So you're getting like that reward, right? Because we know that reward is, it feels stronger. It feels good in people that are impulsive. And we seem to have better retention rates. So that's an example of a change that we made to really like meet the people that are being served by the treatment.
Yeah, no, I love that, especially because I am one that's like, I'll drop out of things. So
I need a win.
Yeah, that was the thing. Everyone is very impressed that this pod has made it 3 years as of this recording yesterday. Because this is the longest I've like made anything that I've committed to anything. So it's just like there's a lot of healing, but also like I really enjoy what I do because obviously I get to talk to people like you and really get this out there. So where is this workbook going to be available?
Yeah, I think anywhere that you can buy books. It's definitely available for pre-order on Amazon and on Barnes and Noble. I like Googled it, you Google like you do, and saw that it was available at Target, and I was like, oh my God, my books for sale at Target.
I love it.
It's also available on the publisher's website, New Harbinger. They do a lot of like self-help books in that space, and they've been really great to work with. So anywhere you get booked, like, so I'm in Kentucky. We have a local chain called Joseph Beth, and it's available for pre-order there too. So pretty excited.
No, that is so exciting. And like you were saying, this can either be for a person that, wants to work on their own treatment, but therapists are really hard to find because I can't remember if you said this on or off camera, but I think you said it on camera, but like still a lot of therapists think that this is untreatable and people with borderline are really difficult to work with. And while I can understand that, that does not help all of us feel like we're just never going to get better. So, and then is it available for therapists as kind of like a guide to, or do you have something separate for therapists?
We're working on a therapist guide, but I always tell people to get the client workbook because it really tells you how to do the treatment. And, one thing that I will say about this is that, while our specialist treatments like MBT and DBT and TFP like undeniably work, it's really expensive for therapists to get high quality training, and it takes a long time to get that training. And so, I think a lot of people that might be inclined to treat BPD are like, oh my gosh, it's going to take a heck of a lot for me to become a specialist here.
Right.
And, BPD, like any disorder, exists on a continuum, right? And so, there are people that have BPD features that could benefit from something like Compass, or people that are, anywhere along the spectrum, right, could benefit from this. but like a lot of communities don't have a DBT therapist. And so we really designed Compass to be it's cognitive skills, it's behavior change, like exposure and opposite action, and it's mindfulness. So it's like three heavy hitters that therapists already know how to do, but like towards the types of problems or personality vulnerabilities that put a person at risk for BPD, right? So it's like and it's a workbook, right? So which many clinicians are familiar with going on Amazon and getting the workbook for the client's problem that they have. So we really were thinking about how can we make this accessible for generalist providers?
No, I absolutely love that. Okay, before we kind of sign off, 2 questions.
Yeah.
Is there anything about this workbook, I keep saying this workbook that we haven't covered yet that you're like, I absolutely desperately need people to know this about, like, what went into it or about the workbook in general?
Huh. I mean, I think I've kind of given like most of the selling points, the values, the personalization,
Right.
get good at fewer skills rather than learn a million
Ugh.
skills and like have to sift through what works for you. Those are the real selling points for I think for like people, and then for clinicians, the selling points are like you're a generalist, you don't want to specialize. Well, these are skills you already know how to do,
Mhm.
so you can confidently treating BPD is not as far away as you think. Yeah, I mean, I think maybe what I'll say about the book is that, I really have tremendous gratitude for all the clients who were willing to participate in a clinical trial for a treatment that, these are good CBT skills, like they'll
Mhm.
probably help, but we didn't know for sure, right? And so they took a risk working with us. And so, we're really grateful for that because that going out on that limb means that we know this treatment works and we can publish it and it can get into the hands of more people that need it.
What was it like for you to publish that study? And because I know in the psych and scientific community, I mean, it's got to be peer reviewed. Like everyone has to kind of sign off on it. What was that like for you to put all of that work into it and then have your colleagues be like, yeah, this is good. Like, go for it.
Yeah, yeah, really great. Really great. This was really the first so before I was at University of Kentucky where I am now, I worked on a treatment development team working on like an emotion focused treatment for anxiety disorders.
Mhm.
And I was like, not in charge. And coming to my job at University of Kentucky, I'm the director of my own lab, and this was really the first study that I was like, this is like so values aligned for me.
Mhm.
This is what I'm doing with my career going forward. And so, yeah, like really, really great to have like researchers be like, this is really cool. But then also, like, I do a lot of training therapists. And so having therapists just be like, when's the workbook going to be available? Or like, oh my gosh, this was such a great workshop. This is so great. I'm going to start using this immediately. That's, I think, like really powerful for me.
Yeah, no, I was so excited when you emailed me and you were like, "Hey, so it's coming out." And I was like, "Oh my God." It's just because I know how much work has gone into it and I know how valuable this workbook was going to be for so many people, especially because mental health access is still a privilege and not a right in the US, and I don't know how it is elsewhere. I'm discovering that it's a little easier elsewhere. But this is going to be huge, especially for borderline. I've Words are really difficult right now, but like borderline people that because I can't think of the right word, um, that feel like they have no hope and they have no treatment and they are just gonna have to live like this for the rest of their life. So this is absolutely huge. So where can people find you if they want to follow along and see what's next, which is going to be my next question. What is next? But where can we find you on Instagram?
Yeah. So on Instagram, I am at self.made.personality. And I'm also active on LinkedIn. So that's
Mhm.
just my name, Shannon Sauer-Zavala. And then my website is where, I have free resources, things that people can download. I have fillable PDFs of all the worksheets for BPD Compass available for download. And that's just shannonsauerzavala.com. I have a hyphenated last name, but it's not hyphenated in the URL.
Right. So what is next for you? We've kind of talked about it a little bit on, you're gonna, you know what you're gonna do for the next trial and stuff like that. But what is next for you and your research?
Yeah, great question. So, right, the immediate next thing is to test whether personalized selection of modules based on these personality vulnerability elevations is more efficient than just giving a one size fits all treatment. So that's kind of immediately what's next. But then the personality modules that we're talking about, so strong emotions, relational difficulties, and impulsivity, they are actually drawn from a bigger model of personality. They're 3 of the big 5. And so there's all of this research that shows that these 5 traits confer risk for basically the full spectrum of mental health conditions. And so I think what's next for me is to take Compass beyond borderline personality disorder and have it be really just a transdiagnostic, very simple system of modules that a therapist could kind of pick and choose and provide personalized but evidence-based care to their clients.
Yeah, I love that. Shannon, thank you so much for reaching out and coming back on and talking about this. I'm so excited to see where all of this takes you, where this workbook goes, how this is going to help people. And once again, guys, you are going to be able to get this anywhere that you can get workbooks. So probably Barnes and Noble, definitely Target. Check with your local independent bookstores to see if they can order it into. It is currently available for pre-order. It is called the BPD Compass, and it will be available in stores August 1st, which is 2 months away as of this recording. But once this lands, it's going to be a lot closer to August 1st. So I'm very excited.
Yeah. Thank you so much for having me. I really, really appreciate it.
Yeah, of course. All right, guys, we will catch you. Well, I will catch you next week. And as always, stay hot and stay messy.